All right, welcome back to another edition of Truth Seekers here. We have Coach Nick Davies, myself, Coach Josh Greco, and very excited to welcome guest Dr. Trey Nunnery. I just want to give a brief background about Pro Advisor Coach. The mission statement to alleviate pain and suffering in the workplace goes with our conversation today, and also Truth Seekers' mission statement to expand consciousness through collaborative content creation. So today's topic is healing, and healing's interesting to me because it involves that there's some sort of pain involved, whether that's physical or emotional, and I think we can all relate to that. So we're just going to keep that in mind as we go through the content today. But without further ado, I'm going to introduce Dr. Trey Nunnery. Trey, please give as much or as little of a brief bio as you'd like. We'd like to get to know you a little bit and how you got into your profession.
All right. So I'm Trey Nunnery. So I am an ophthalmologist or an eye surgeon here in Charlotte, North Carolina. I was born and raised in Atlanta, Georgia, and I went to UGA, so University of Georgia, go Dogs. I stayed in Atlanta for my medical school education and also stayed in Atlanta for my residency in ophthalmology. So that's actually where I met my wife. I met my wife my first day of internship, and everything just got better after that. So after residency, I went and did a fellowship in corneal transplant, anterior segment pathology, and refractive surgery up in Albany, New York. And my wife actually is also an ophthalmologist, and she did a fellowship up there as well in oculoplastics. And so we stayed up there for 2 years. And then, so our families were down in the Southeast. So my wife's family in Raleigh and my family in Atlanta, and we decided on Charlotte. And we love Charlotte, and I'm so excited to be here, sort of working as a cataract surgeon and a refractive surgeon. So I do cataract surgery, and I do so refractive surgery like ICLs and LASIK and PRK. So I'm a physician, but I'm also an eye surgeon.
That's awesome. So maybe if you could share, like, what drew you to that field? Why was that of interest to you?
So growing up, so my father is also a physician. He's a pathologist. So he's somebody that looks under the microscope to sort of, figure out if something is benign or malignant, if there's cancer or not. And so I kind of grew up. So I grew up kind of emulating him and seeing him in the lab and the office, looking through a microscope, and I wanted to be just like him. But in medical school, so we do a lot of rotations. We go through a lot of different fields. So we do neurosurgery, we do anesthesia, we do pediatrics, and I really wanted to get, kind of get my hands a little dirty. And so surgery really appealed to me. General surgery was an incredible rotation for me. I just loved it. So I loved the high energy. What I didn't like was sort of staying up all night in sort of big bloody cases. So what I sort of wanted was I wanted to sit down when I operated, and ophthalmology was that specialty. I also like the idea of microsurgery and sort of using a microscope and just small little movements with my hand to achieve some kind of tangible result. And ophthalmology really appealed to me as well because basically you can do a lot of positive good in a short amount of time. So I think my attention span was a lot shorter, and I didn't want to do those big, long cases that took 4 or 5 hours. So that's kind of how I kind of got involved in ophthalmology. And it's just an incredible field that I'm learning, new things every day. And so at my baseline, I'm a medical physician, but I'm also a specialist in the eye. So I'm kind of an expert in the eye, if you can be an expert. Every day, again, I'm learning more and more, and I'm learning what I don't know as well. But I'm really specialized and focused in one area of the body, which is the eyeball.
Yeah, and if we could maybe talk about the genesis of our conversation a couple weeks ago, there was a really cool moment where obviously you were doing your thing with, it was, forgive me for not using the right professional terms, but just like a little magnifying glass or a little light that you held in front of another magnifying glass. class, and you could see the back of my eye.
Yeah.
And talk to me about what you were looking at when you did that.
Yeah. So in ophthalmology, we really do have a window into the body. What we're looking at when we use the microscope is we're looking at the front part of the eye and the middle part of the eye and the back part of the eye. And so the front part of the eye you can look at with just a beam of light. So you can think about it like a flashlight, really. But it's really like a concentrated, focused, narrow beam. But in order to look in the back part of the eye, so I actually need a little magnification to help me. And so I use these small little lenses. And so they almost look like sushi rolls, but they're very, very high powered lenses. So we measure lens strength in terms of diopters. So in physics, that's 1 over focal length. So it's sort of, it's similar to a camera. But so these lenses are very, very powerful lenses that sort of magnify. And so I'm able to sort of look past the middle part of the eye and see the back part of the eye. And it's an incredible landscape. If you've never seen the back part of the eye, you should, because it's beautiful. And that's one of the reasons why I loved ophthalmology. So you get to see the blood vessels, you see the arteries and the veins, you see the optic nerve, and that really is the central nervous system. So you're seeing like the central nervous system, you're seeing the vascular system, you're seeing the health of the eye. So it's a window to the back part of the eye. And so we were kind of talking about how you can see diabetes. So actually I could be the first one to see the manifestations of diabetes.
Wow.
So we see small little blood vessel changes, and we see high blood pressure changes as well. And actually we can be the first to see high blood pressure. We can see optic nerve changes that might sort of indicate that there's pathology in the brain, maybe a brain tumor that's pushing down and sort of causing swelling in the optic nerve. We can see infection very easily. Not necessarily blood-borne infections, but infections in the eye. And so it really is an incredible way to kind of just get a snapshot of someone's health. So I don't think of myself as a primary care physician, but in a way, I really do work hand in hand with those folks to sort of evaluate patients that are newly diagnosed with diabetes, high blood pressure, and who might have any vision changes. So we were kind of talking, and so I kind of get animated and excited when I talk about the anatomy of the eye and sort of optics. And so I guess that would also, be another one of the reasons why I was interested in going into ophthalmology in the first place.
Yeah.
I feel like my knowledge of any sort of optical knowledge is just gone from 0 to a million. And I know that doesn't even, that's a ridiculous thing to say, but it's just, thanks for sharing that. That's really cool. Just there's none of that stuff I knew zero of, like nothing at all.
Well, we actually don't learn anything about ophthalmology really in medical school. It's all the postgraduate training. So that's where you kind of learn it. So, we kind of learn on the job. And so it's not just the evaluation of disease in the clinic, it's also surgery. And so I think we were kind of talking about that too, Josh. And so it's just really fun to do what I do. Anyway, I'm excited that you found it, interesting as well.
Yeah, I just find the whole thing fascinating, and I can hear the passion in your voice. So I think you found the right field to go in, and not to mention, you get to help people along the way. I think that's awesome. It's something that you and I have in common,
yeah,
with our professions here. And I'd like to ask Coach Nick something, because, well, first of all, I'd be so curious to see the health of Nick's behind Nick's eye, what that would look like. But what I got out of what Dr. Nunnery was saying was, there's things that we can tell from people, by looking within, that we might not normally be able to see from just their appearance. And I think of other pain that could be hidden. So the pain of diabetes, or what that would look like. Coach Nick, does that resonate with you at all?
Yeah, I think you're referring to the physical aspect of it versus the emotional aspect of it, or the beliefs aspect of it, or what you might not see that's physical that may show up elsewhere in terms of the actions that you take in your life, therefore the results you get in your life, and putting all these things together, and that having a physical manifestation of it or not, I'll get there in the end. Is we'll see, but I guess there's so many ways to think about the healing part of it. Right?
Yeah.
Is that what you're getting to?
Yeah, well, like I mentioned before, so healing kind of implies that there's pain somewhere.
Yeah.
And like Dr. Nunnery was saying, like until you shine that light, he could be the first
Right.
person to find some of these, illnesses in people. So I think that's interesting, and I know that's kind of a pivot away from the eye, but I think that's important for everybody to keep in mind with some of the stuff that we go through on a regular basis with our jobs, our personal life. Like what's below the surface that maybe we could use some healing with.
Yeah. Are you
Josh,
willing to take a look?
Yeah. That's a great point. Just to kind of piggyback on that concept, what I do is so focused. It's, really the medicine part, it's the biologic part. But, there's a biopsychosocial model to kind of healing. And so, the biologic and the psychologic sort of go together. That's really the body. But there's a whole sort of social aspect too. And so, what I'm trained in is a specific area. And, it's just a small part of the puzzle, like a small piece of the pie. The social aspect is so huge.
Yeah. If you don't mind, Dr. Nunnery, I might ask you to come out of your comfort zone a little bit with, like, you've been so helpful with your expertise, but like in other aspects of your life, with either physical pain, I don't know if you have an example to give, or just maybe how you go about addressing things, or how your mindset works. I don't know. Kind of out there.
Yeah. So you kind of cut out for just a second, but I think I got most of that. Yeah. So, so I think I have a mindset that suffering is a part of life. But one of the reasons why I got into medicine was to become a healer, a specialized healer. And so I can kind of control that aspect of things. I can be an expert in a very small sphere of influence. But there's, everything else around us that is really uncontrollable. And so we have all these other healers around us in different roles. And we have social workers, we have nurses, we have coaches. And, for me, kind of understanding that suffering is everywhere and it's a part of life, I have to kind of think, well, what does it all kind of mean? Why is it a part of life?
Yeah.
And, one of the things that happens when the body is injured is it heals, it oftentimes regenerates. And I think that suffering around me and suffering that I've experienced, personally, be it like mental anguish from, losing loved ones or going through a very difficult situation, like interpersonal problems at workplace environments, or, through training, I think, how is this strengthening me in the long run? How is this pushing me to grow? And so that's what healing is it's not just this sort of medicine concept. It's so much more than that. It's a growth aspect. And so even if we're not curing something, we can be healing and healed. And so for me, I kind of look at suffering as not something I'm looking forward to. Like, I don't want to suffer, but I do know that it teaches me something. And I'm a better person when I've gone through that process, because it really kind of makes you look inward, and maybe it like allows you to see things from a different perspective and maybe reassess, maybe I didn't have something right. Maybe I'm not an expert, maybe I didn't make the right decision. And can I accept some negative feedback? And so that's kind of what suffering is in a way. It's negative feedback. But if we can sort of fundamentally organize our lives to kind of get feedback all the time, we can grow. And suffering is a part of that. You can look at like Olympic athletes. They're suffering all the time. But they call it training. And so they're growing from that. They're becoming, like elite athletes from this suffering, this, day-to-day suffering. And so for me, that's also how I see it. So I can't control a lot of the things, around me, but I can control my attitude, and I can see it in a different way, and I can make it be a positive experience in the end. So that's kind of how I see it.
It's so cool because, Coach, we this is how we work in a lot of time conceptually. Right? You asked Dr. Nunnery if he wanted to get out of his comfort zone, because if we think about everything we do moving either away from pain or towards pleasure, I think what you're talking about, Trey, is that it's the baseline is here. If the body is hurt, you're suffering. It needs to heal to get back up to here. And then the other thing that we work in a lot as well, and I'd love to hear your thoughts on this, is, well, it's not just a case of suffering, healing, coming back up. There's that growth part you talked about. But what if you spent all your time, this is the baseline, and then jumping up and stretching, jumping up and stretching? Because when you do that, it's a whole different world. It's like, well, what can I get to? Not what can I recover from? Like
exactly.
That's where the whole world opens up.
It's expanding your comfort zone. And, to get out of your comfort zone is to suffer, a little bit. But, if we're not growing, in a way, we're dying. But growth can mean all different types of things. It's challenging the boundaries that we've kind of put up around us.
Yeah.
That we've kind of insulated ourselves with.
Yeah, and a lot of time it's the catalyst from which it does that. Is it a pain catalyst, or is it a pleasure catalyst? Which is an interest. And to your point, the difference on that just might be the mindset. It might just be the attitude on it. Whether I see it as a pleasure or I see it as a pain is your choice as well.
Yeah.
Back to what we were talking about kind of prior was, you just get to choose. Yeah. So if you were thinking about putting these concepts together into something that's like really usable, I think that having this an example with your expertise is super powerful. If you were to boil it down into, say, 3 actionable items that you could take away, kind of put into practice, how do you think about that?
Oh yeah, for me.
Yeah.
Oh, interesting. Okay, so 3 actionable items, kind of to deal with suffering or to heal.
Yeah, absolutely.
Okay. Okay, so I think one thing would be to identify a painful experience or an experience that pushes you or makes you feel uncomfortable. And then 2 is to look at that experience or that moment and ask, is this a growth opportunity? And then 3 would be to look at that and say, what can I learn from this? And how can I grow? And let's change something in my life that maybe is an entrenched behavior, is an entrenched action, is an entrenched mindset. And then let's break free. Let's just pop right through it. And we see that every day. We have these experiences constantly. So there's not going to be any sort of dearth of these moments.
Yeah.
So I think those are kind of 3 things. But I'm sure I could kind of refine it, if you gave me more time.
Hey, we haven't got more time. That's the only thing we can't get more of, right? So it's go looking, like seek the truth out in terms of what that experience could be that takes you out of your comfort zone, and then find it and ask what's the moment here that I can grow from, and then lean into that and say, what is it specifically I want to learn?
Exactly.
Is that right?
Once you have those 3 things, then you kind of look at yourself and you go, oh my gosh, I do hard things and I get better because of it. So you go out and you try to find challenging situations that are growth opportunities. And then you kind of think to yourself, oh my gosh, this is empowering. I can do anything. And that's not really, fully accurate. Like you can't fly, like you have to sort of, listen to the laws of physics and that kind of thing. But, it's empowering more in the sense that you're not intimidated by experiencing new things and being ambitious and looking at life as a huge growth opportunity.
I love that. I'm glad that you phrased everything that the way that you did, because it makes going through life so much different then. Like you don't have to live in fear. Anything uncomfortable you can embrace as a new opportunity to learn something and to grow from that. So
Yeah.
for that I thank you for sharing that, and I'm glad we got to the spot that we did. What do you think, Coach Nick?
Fantastic. I think we can continue, all day long on this, and I think there's a lot more stuff which we should do it again for sure.
Yeah.
Yeah. Well,
Sounds good, guys.
yeah, we appreciate you coming on, and thank you for contributing and being a part of Truth Seekers.
Josh, Nick, thanks, man. Yeah.
Pleasure.
All right, guys.